CPT JJ-CPV Introduction, page 12, part 50.
Selection of procedure continued.
Continue, right? A physician or other qualified healthcare professional is an individual or a person who is qualified. Qualified how? By education, training, licensure, regulation when applicable, and facility privileging when applicable, who performs a professional service within his or her scope of practice and independently reports that professional service. So this is this part of the theory is focusing on who performs the procedure. The physician or other qualified healthcare professional, right? And the little table there tells us in summary what it is, right? Can you read it?
Physician or other healthcare professional.
It's an individual.
Individual qualified.
By.
Education, training, licensure, regulation, and facility privileging.
Privileging. This is how you identify the person who is responsible for the procedure. That's all our theory for today. Is just identifying the person who performs the procedure. Okay? So this is our theory. So now we're going to do a problem. So ready, set, go. Okay, CPT JJ-RVA. This is page 252, exercise 37, level 1. It reads like this.
Surgery, musculoskeletal.
Uh-huh.
Patient is brought to the emergency room following a shark attack.
A shark attack, right?
Yes. The paramedics have the patient's amputated foot.
Amputated foot.
The patient is taken directly to the operating room to reattach the patient's foot.
The patient's foot, right? So it's a surgery section of a CPT book. It's a musculoskeletal, and the patient is brought to the emergency room following a shark attack. Okay? The paramedics have the patient's amputated foot. Now remember here it says amputated foot. In the tips you're going to find something, but this is, I'm just pointing this out. It's amputated foot. The patient is taken directly to the operating room to reattach the patient's foot. Okay, so that's the procedure. And now we're going to count to 3 so you can pause the video and give us the CPT code for this procedure. 1, 2, 3. All right, the answer is 20838. Okay, you got that? Well, if you got it, congratulations. If you didn't get it, let's give you a tip. Okay, the first tip.
Start with replantation.
Start with replantation. And now, what is replantation? We have a little explanation of that, what it is. It's a reattached amputated foot, right?
Right. This is a surgery definition of replantation.
To suture back the body part.
Especially with the use of microsurgery to
reconnect the nerves and the blood vessels. Okay, that's what replantation is. Okay, now the second tip that we have is
the procedure is for patient's amputated foot.
Right, by default, which means if nothing else is indicated there, this means that it's a complete amputation. Why? Because if it were incomplete, the text or the description would tell us it's an incomplete amputation. But since they don't tell us, they just say amputated foot, then it has to be a complete amputation. Right? I mean, it's separated from the body, right? Okay, so now with these 2 tips, you should be able to find the path to the answer. Now we're going to count to 3 so you can pause the video and give us a path to the answer. 1, 2, 3. Okay, this is the whole summary of the problem. It's a surgery section of the CPT code, the musculoskeletal part. The patient is brought to the emergency room following a shark attack. The paramedics have the patient's amputated foot. The patient is taken directly to the operating room to reattach the patient's foot. There's only one code, and the code 1 through the index is found like this.
First you go to index.
Go to the index.
Then you go to replantation.
Start with replantation.
Then go to foot.
Go to foot.
Then you get 20838.
20838, right? That's the code that you get from the index. Now we're going to check this code in the tabular. So the code 1 through the tabular is found like this.
First you go to tabular.
Uh-huh.
You first go to 20838.
Which is the code that you found from the index, and what do you get there?
Replantation, foot, complete amputation.
Complete amputation. And since in the tips we have told you that by default, if it just says amputation, that has to be a complete amputation. So this is our code, so that's why we have the equal sign, and then we double check that the answer is 20838. Okay? So thanks for watching, and now please don't forget to visit our website, and also
you could subscribe to us in YouTube by clicking here for our new medical coding videos.
Right, in the rectangle, the red rectangle that says subscribe. And what do I get?
You get up to 3 videos every day that we make. ICD-10s, CPTs, all that is needed to pass the medical coding certification exams.
Okay, so thanks for watching, and don't forget to visit our website and subscribe to our videos. Thank you.
Goodbye.
Bye.